Welcome to the RX Physiotherapy Podcast, your go-to destination for all things physio, rehab, health and wellness. I'm April Patterson.
And I'm Brendan Casey.
And each week, we will dive deep into fascinating topics within the health world. From physiotherapy to nutrition and beyond, we cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness.
And before we begin, we'd like to acknowledge the traditional owners of the land which we meet today, the Dharawal people, and pay respect to elders past, present, and emerging.
Let's get started.
Good morning, good afternoon, good evening. Welcome to episode 3 of the RX Physiotherapy Podcast. We've got an audience member joining us today, which is Reese Nicataris.
How is going?
Reese has just come on board and hopefully for a long term.
Yep.
And we might do a podcast later on with Lol.
That'd be good.
Excellent. Reese's primary interest is in knees for now.
Yes.
Alright, fair enough. So any total knee replacements, ACLs, super complex knees will go straight to Reese.
Yeah.
With
a good plan, yes.
Yes. So April, we've already discussed the diagnoses. No, sorry, we're discussing diagnosis today. We discussed what hypermobility is, the methods that we use to treat it in terms of exercise.
Yep.
What's the plan for today?
So today we're going to go through in a bit more detail some of the common comorbidities that you find with hypermobility. And then we're going to go through an overview of the process to get diagnosed, because it can be quite convoluted and hard to know who to go to start the process.
Yep.
And so that I would have really found helpful when I was in my process of getting diagnosed. So we'll start with those two.
Fair enough.
Yep.
All right. Let's talk about, do you know any actual statistics just off the top of your head? Not sorry to put you on the spot. But about the comorbidities, what's the most common, what's the least common, what's kind of in the mix but hasn't really got the strongest correlation either?
Yeah, so GI issues are the strongest correlation. I think it's upwards of 90% of people.
Wow.
So the gut is made of the same collagen fibers as the ligaments, so the gut is directly affected. And this looks like increased levels of bloating, pressure in the abdominal cavity, just because things are getting kind of stuck in between the tubes, like in the tubes. And also because the actual way that the gut is absorbing food is different, there tends to be a higher chance of things that you don't want getting through and things that you do want not getting through. Okay. So you can think of, you've got a tube and that's where your food is in and your body's got to break it down. And then it's also got to retrieve it through little junctions into the bloodstream from the intestines. Whereas ours, the junctions are what they would call loose. So it just means that they could take more in of things that they shouldn't. And due to the fact that, as we've spoken about, individuals with hypermobility have a higher chance of having stress and anxiety, it puts the gut into a higher chance of dysbiosis as well. So you end up with less of the good stuff, more of the bad stuff, and more of the bad stuff's getting through.
Right.
So put it in simple terms.
It makes a whole lot of sense that, the GI tract is so pliable and so malleable in most people.
Yes.
You add in that extra level of hypermobility.
Yep.
Then, you can see why it can cause so many problems.
Definitely.
What kind of things do people with hypermobility lean on to deal with those kind of GI tract issues?
So you'll find that pretty much all individuals with hypermobility will have quite a few intolerances. Me personally, it's lactose. When I was born, I went on lactose milk after a period of time and ended up in the hospital because my body just couldn't cope with it.
Wow.
And another common one is gluten. Anything that tends to have a higher level of inflammatory cause in the body tends to be not well received. So just eliminating that stuff out of the diet, when I say just eliminating, it's actually really big thing to do, but that you're essentially taking away the fire of the inflammation cycle. And then exercise helps move things through the bowel.
Okay.
So you're not getting as much blockages. And also to eating enough fibre, all the other stuff that comes with it, drinking enough water. So essentially all the stuff we do to look after ourselves in general. As we should,
yeah.
But it's even more so for...
More important for you
Yeah.
guys.
Exactly.
Because we all know people who are lactose intolerant, gluten intolerant, but are far away from that spectrum of hypermobility.
Yeah.
That makes sense how it's compounding even further.
Yeah.
Because then it's the gut tract is letting things through, even more information through those barriers.
That's right.
Yeah, that's a rough go.
Yeah. So we already know the link between the gut and the brain. So if you're under lots of stress, certain strains of, bacteria that help us break down food aren't going to be able to survive. Means you're not going to be making as many of the neurochemicals you need as well, which is going to feed back on the anxiety thing.
Sure.
But yeah, it's also going to mean that, more inflammation. So you're right. People who don't have hypermobility can definitely have, gut issues as well. But you take that and you put it in someone with looser junctions and a higher chance of blockages, which means that it's just sitting there for longer. So it can get absorbed more.
Great.
More of the bad stuff. So that's number
Very
one.
interesting, but makes a lot of sense. And that, without jumping ahead too quickly, I think we touched on this a little bit last time, how nutrition is a problem for a lot of people with EDS and hypermobility because of the GI tract issues. And then that affects your exercise, and
Yes.
once again, that just compounds more and more and more.
Yep.
Okay, fair enough.
Yep, definitely. The second most common one is autonomic dysfunction. So that just basically means the automatic functions of the body aren't working as they should. And this can manifest commonly in a condition called POTS, where your body struggles to maintain your blood pressure in different positions. So this is the person that is fine when they're sitting down. As soon as they stand up, they nearly faint. Their body's not regulating the blood pressure back up to the brain in that effective way. And the way that the body actually deals with this is through increasing the heart rate. So you imagine when your heart beats, it's pushing all the blood through the vessels. So the body goes, oh my God, not enough blood in the vessels. So it just gets that heart going to try to pump it through. But then the body also senses a spike in heart rate as a threat. So then you're also getting anxiety because you're getting cortisol dumps all the time. So not only is your body stressed from lack of, a lot of the time when you test someone's blood pressure, the blood pressure will actually seem normal. It's the heart rate that you have to look for.
Well above.
Exactly, because that's the compensation.
Yep.
So this is usually managed through appropriate levels of hydration and electrolytes. That makes a huge difference.
Build up that blood volume.
Exactly.
Without getting too sciencey.
Yeah.
It's, I guess, an easy way of explaining it would be if there's more fluid in your system,
Yeah,
your blood pressure increases naturally.
exactly.
So for someone with high blood pressure,
Yeah.
that'd be the worst thing you could do. But for someone with POTS, and what does POTS stand for, by the way?
Postural orthostatic tachia syndrome.
POTS is a better word.
Yeah, so the other thing too with POTS is that individuals will have a lower exercise tolerance, especially in heat. So, and it's best not to push through it. So these are the people who might run for like 5Ks and they feel super dizzy and they're going to faint and vomit, and your body, you just need to stop. Your nervous system is so stressed at that point that you need to stop. If you can manage it with your fluids, then and you're not getting those symptoms, then you're one of the lucky ones, but some people just can't.
As a non-runner, 5K sounds a lot.
Can't remember the last time I ran 5Ks either. What about you, Reese?
Yeah, I'm the same, I guess.
Oh.
Very interesting.
Yep.
And that ties back into the last podcast again about how these people would do better doing shorter stints throughout the day in terms of exercise, so they can cope with it far better.
Absolutely.
And then they have the added variable of, all right, it's a hot day, I'm not going to exercise outside, or I'm going to take it easy outside, or I'm going to make sure to stay inside well-conditioned environments.
Yeah.
And I guess for those people, like a heart rate monitor might be a really good idea, even if it's not the most accurate thing in the world, as long as it's reliable. That
Definitely.
could give them just a general idea. So whether the
Definitely.
Apple Watch or the Aura Ring, depending on how much you want to spend, we're not saying they're the most accurate things on the planet, but it's something.
But at least it will tell you if your heart rate's, looking like it's nearly 200.
Yeah. And you're wondering why you're sweating bullets and
Feeling
panels
really...
and goes.
Exactly. Yeah.
Okay.
Definitely. But it's really interesting to talk about this with high-performing athletes. Because you'll get CrossFitters who they'll say...
Oh, yeah, that's me all the time.
Yeah,
Yeah.
exactly. And from what the research shows, you don't want to push through that because you're just stressing your body out so much. So that's a difficult conversation to have around that, depending on their personal presentation.
Yeah.
But
And
not
not to knock CrossFitters, but we all know they're all very devoted.
Yep,
And they're definitely one of the harder patients to get to pump the brakes a little bit,
definitely.
because the sport itself is go 100 miles an hour,
Yeah,
which is honourable and it gets great results, but there's definitely a point where you have to listen to your body.
definitely. And I'm the perfect example of this. Did CrossFit for 10 years, burnt out all the time, would get through a workout in summer and be like, I can't even move, I feel sick.
I'm done for the day.
I'm done for the day. I now need to be a zombie.
Yeah. And you think, what's the
What's the point?
What's the point?
Yeah.
Where's the... Because I think Joe Rogan made a really good point on this, that what if you could exercise and feel amazing afterwards?
Yeah,
And I think that's a great thing to aim for, but we rarely do.
so true.
We're so often chasing that feeling of exhaustion,
Yep,
almost.
it's true. And this is where we need to get Taran on board, because this is his whole aim with his strength training classes. Since being on his programming, which I train like 4 days a week, it's like 5 exercises and rehab stuff. I never burn out. I feel good after exercise. I have more energy.
That's awesome.
Yeah,
It's literally like what we should all be aiming for.
exactly. More is not better, especially if you're female and you're hypermobile. Yeah.
Fair enough.
Interesting.
Reece, you trained yesterday, didn't you?
I did.
How did you feel afterwards?
Felt amazing, to be honest. I
Alright.
felt like more productive.
So
coming
Reece
together.
is fine.
Yeah.
Reece
This
is
sort of
killing it.
morning, but
Okay, fair enough. On a side note, they found that and this could change again as well with the research, that the soreness that you have afterwards doesn't even closely correlate in terms of progress.
Yeah. Yes.
Like, you can be sore and make progress. You can be not sore at all and make progress.
Yeah, exactly.
Once again, I'm just like how stretching is slowly coming back into vogue again. I'm sure that'll flip flop again.
Yeah.
It's
Just got to take everything with a grain of salt,
yes.
and for the person in front of you.
Mm-hmm. That's good.
So-
What's the last kind of section here?
So fibromyalgia would be the next one that's most like highest correlation. So fibromyalgia is a really interesting condition where individuals can have a mixing of pain signals. A good example is I had one client who she kicked her right toe and she felt it in her left. So the body just kind of
Completely dysregulated.
Yeah, your joint is giving the brain information about the structure, and your brain is interpreting whether that should be something to be stressed about also. So then the brain is what's creating the pain.
Yeah.
So your body's giving normal signals to the brain, but the brain is perceiving it as a threat and giving an inappropriate response, pain response. In this individual's case, it was the other side. So it shows you how like the body is, it's not,
Can have such a big effect.
yeah. And these are the individuals that will have joint pain like in every joint. And they'll feel like they're an absolute hypochondriac, or they'll just feel like something really bad is happening to them. And when you test their joints, are actually not, they don't really display any signs of, serious dysfunction,
Yeah.
but that doesn't mean their pain's not real.
course.
Like they're genuinely exactly feeling that pain. And I find with individuals with fibromyalgia, they've been invalidated for so long that it just makes them... It's like when you know something's wrong with you and people tell you it's not, and you just want to hamper it more. Like you want,
Yeah.
So I think it's really important to validate people that their pain is real, explain to them that there's actually a misfiring of the nerve fibers, but doesn't mean they're not experiencing that pain genuinely, and giving them pain education, but not in a way where it's invalidating.
Yeah, and I've definitely heard some patients' experiences and of how they've just been invalidated or they've been put down. The one thing I hear sometimes, which infuriates me, is that it's all in your head.
Yes. Yeah.
That could come down to really poor education on the therapist part.
Yes.
Because we grow up knowing, I banged my knee. Obviously the pain's coming from my knee. When we know the knee just sends signals to the brain, just like you said, and then the brain decides what to do from there.
Exactly.
So is it all in your head? Technically,
yes.
Because that's where all of our sensation comes from.
Yeah.
But it doesn't mean that the pain isn't real, just like you said.
Yeah.
It really is a hard path to walk, just because these people are in a lot of pain. And like you said, most of the time they don't have much going on joint or muscle-wise that you would think to be too concerning. That's a good word.
Yeah.
But same again, it's something that you have to work through, something you have to work around, and it's the explained pain model, which we can definitely get into it on a later episode, is excellent for that, because it's not about ignoring the pain, but rather finding ways to work around it, because the pain's going to be there.
Yeah.
But it's about enhancing your life around that pain.
Exactly.
What I've found, especially early in my career, and Reece, you might have found this already as well, that people come in and they want to be pain-free. And that's their main kicker for, I'm 100%, I'm pain-free.
Yeah.
But in reality, I can't remember the last time I was pain-free.
Yeah.
I'm sure you're the same.
I'm the same.
Reece, I'm sure you got little aches and niggles here and there.
Let's get in there.
Yeah. Which is, again, isn't a sign of anything.
No, exactly. It's your body. Your body only cares about survival.
Yes.
So it thinks short term. It's like, how am I going to survive now? So anything that it perceives as a threat, which could be an old injury that has had a little bit extra force that week through it, the brain's going to go,
Just
we
let
don't
us
want
know.
to. Exactly.
Yep.
Hey, don't push it.
And I try to tell patients who are much more, I guess, stock standard is the word, or that's not a great word for them, that it's... how do I explain this? Because I just lost my train of thought. This is definitely the earliest one we've done before.
You need some more coffee.
Yeah, probably.
No, but I know what you're saying. Your body just wants to keep you alive. It's thinking in that moment. It's not thinking, if I give pain and it causes my human, in inverted commas, to avoid exercise for their whole life. It's not thinking of that ramification. It's thinking, let's keep this hip joint
Still. For a day,
exactly.
And we should be okay tomorrow.
Exactly.
Or in an hour, but it rarely ends up that way.
Yes. And it's great that we have this, because if we didn't have pain, God.
It'd be terrible.
We wouldn't have survived. So, yes. But this is where, with hypermobility, because the body has already got its mind less stability than it requires and a greater range of motion to protect,
Yes.
it is going to have these overzealous responses, much more likely.
Threshold is much lower.
That's right.
And that's going to be variable for, I'm assuming, each joint.
Definitely.
As well.
Definitely,
Because
actually.
we talk about how the lower body tends to get affected more often than the upper body. But then again, everyone's different.
Yeah, as a general rule, that is true.
Okay.
And I guess it's like just the overload factor, right? We're not using, we're walking around a lot more than we are. Yeah.
Oh, I remember.
Using our arms.
How? That took a long time to come back to me. A point that I always bring up as well is the fact that if you're a very active person, this goes for more like middle-aged people.
Yeah.
You're going to have aches and pains if you're active. You're going to have aches and pains if you're very sedentary.
Yeah, definitely.
Absolutely. For different reasons, obviously. But you would
100%.
much rather have them for being an active person.
That's right.
Because I think you can get injured from improper training. But freak accidents do happen.
Yep.
Overload happens.
Yep.
You can have a poor night's sleep, lots of stress that day.
Yep.
And then the next day your tendons are just flared up. That's part of the game. We know it is. That's why we stay in business, essentially. It's, like I said, you would rather be that active type of person.
Yeah.
Because it's going to happen no matter what, sadly.
Exactly.
Some people are very lucky and they get through. We've had patients in here who are in their 60s, and they're like, "Oh, this is my first injury," and I think, "How have you gotten so far?"
Yeah, you're like, what?
Yeah. What have you been taking?
Tell us everything. Yeah, so, and then the last one would be, and I think this number would actually be a lot higher, but I think we went into that in the last podcast, so I won't dive back into that. But anxiety and neurodivergence, so that's seen to be 50% correlation.
I remember you saying that, yeah.
Yeah, I think we don't understand how to quantify hypermobility properly. So some people do only have it in the gut, and that's really hard to work out. You're not going to be able to cut someone open and work it out. Just in the fact that some people have it in all their joints, some people only have it in the upper body, some have it in the lower body. So it's really hard to, quantify that. So I think that number would be higher. That's my little nugget. There's no, study behind that.
I'm sure as more research comes out, we're going to find out more and more.
Exactly.
I didn't know that it could be just related to the GI tract and nothing related to the musculoskeletal system. That would make it very almost hiding the symptoms.
Definitely.
Because we all know people who get backed up really easy or have problems going to the bathroom or just don't tolerate a lot of foods, and they put it down to a genuine food intolerance instead. And there's still those people, of course, as well.
Yep.
But it makes sense. Just shows how grey we are, doesn't it?
Yeah, and
There's
how
no black and
complex the
white.
human body is.
Needlessly so sometimes.
Yeah. God damn it. But yeah, so anxiety is a big one, and that's a lot to do with the autonomic dysfunction stuff and just your body sensing instability at the joints and responding with a stress response. So essentially you've got high levels of cortisol running through your body. Cortisol is the hormone our body uses to stay alert, ready for something to happen, even though that's happening internally for us. So your body releases cortisol, and then a different part of your body goes, cortisol is released, this means this, when the reason why it was released isn't really known. It just says cortisol is released. So therefore increased anxiety, or what we perceive as anxiety, which is being more,
Heightened state.
Heightened. Yeah, perfect word for it. Heightened state. They're the main four that are correlated with it in terms of comorbidities. And this is where it's really important to look at the individual. So if someone comes to you and they only have issues with autonomic dysfunction, so like standing and regulating posture, then you're going to want to deal with that first, then go, here's 10 exercises to strengthen you, because you're going to end up, causing them much more stress and making it worse. So you've just got to work out what is their main symptom.
That's, I think if you took away one thing from this talk, that's huge.
Yeah.
For either just people who think they have EDS or hypermobility, or practitioners or students, that's probably the biggest rule of thumb I can think of.
Yeah, definitely. Yes. Yeah, definitely have to treat the individual.
Yes.
Yes, but...
Right. Let's go, and we talked about how we're going to put this in a bit of a mind map later on film to make it a bit easy to understand, but we're going to go through the diagnosis process, correct?
Yes.
Right. What would be step one? As in general. Very, very general.
So if it was me, so I'm going to say it as if the practitioners around you have no idea what EDS is, I would download the EDS checklist that's on ehlers-danlos Society, and I would go through that myself and identify which ones I resonate with. To just tick the boxes, Google what each line says so you understand it, and then take it to your GP and say, I feel like I have this, these are the things I resonate with. From there, your GP will send you to a rheumatologist, and they can make the diagnosis just off that checklist. So then you will be diagnosed with EDS, but they won't have identified what type you have. And this is the frustrating part, is they won't genetically test you unless they see probable reason to. So that would result in having some sort of heart issues that...
Okay.
So if you'd had any sort of... in order to get genetically tested, first you need to go to a cardiologist, and they will do an ultrasound of your heart and just see if there's any vessels that are affected. that, or if you've got any history of like aneurysms or strokes that are
Out of the ordinary.
out of the ordinary. If you don't have any of that, they really hesitate from genetically testing you, unfortunately, even though we know that there are like over 20 different types of EDS, and some of them are more scary. Like my younger brother, and he won't mind me mentioning this, he ended up having his splenic vein rupture, like out of the blue for no reason.
Tell us how important the splenic vein is.
Very, very
Yes.
important. Very, very, very important. Luckily, he's fine, and they were able to do emergency surgery to stop the bleed.
Yeah.
But that's an example of, if you have that, you kind of want to know, so
Yes,
that
definitely.
you can keep an eye on that. So to just go back, you want to go download that checklist, which we'll put in the YouTube video actually,
Good idea.
and then tick what you've got in, like, that you resonate with, take it to your GP, be very firm about it, especially if you could tell that they're a bit hesitant because they could just not be very educated on it, and go to the rheumatologist, get the diagnosis, speak to them about your concerns of having any of the more serious types. If you've had anyone in your family have anything like that, definitely bring it up, because that will strengthen your case of getting genetically tested. And as soon as you've been to the rheumatologist and they've said to you, yep, you have EDS based on this checklist, and you're diagnosed with it, and then from there, if you did require anything like NDIS funding or disability pensions and the rest of it, that can be enough to qualify for that.
Okay.
The only thing is that to find out if you have those more serious conditions, it needs to be genetically tested, yeah.
So really you have to go down that pathway first. Obviously, stuff would be all out of pocket, but if you're having some very serious symptoms and you're genuinely concerned, it's always worth investing in your health. Simple as that.
Definitely, 100%.
Okay.
Yeah.
I think that's fairly straight. On paper, it's fairly straightforward, but a lot of people we've heard, especially from our patients, how they've been given a bit of a runaround, or they've had lots of delays, or same thing. And it's not knocking the GPs or general practitioners, that if they just don't know, they don't know.
Exactly.
Or
And
they don't
this,
have the experience around it. That's just what happens sometimes.
exactly. And this is where you got to advocate for yourself. And I know it feels really uncomfortable to advocate for yourself, but you deserve to be properly assessed, especially for something that can affect such a big aspect of your life. So stay firm in your conviction with this one.
Fair enough.
Yeah.
Okay. And we'll definitely write this down on that big whiteboard sitting out in the gym there. We're all visual learners in some degree.
Definitely.
How many learning styles are there again? I think there's 57.
Is there?
Yeah.
Wow.
It's ridiculous, because there's all the ratios in between.
Oh my god.
Someone's going to correct me on that for sure. They'll be like, no, it's 58.
Can't believe it, Brendan. Get your numbers right.
Before we finish, is there anything that you wish you wouldn't have done differently? Just from a personal side of things, when you were trying to get diagnosed? What you just described, the way that you wished it went down.
I think it's more to do with how much I used to push my body, and think that, oh, you're just being weak or you're just being lazy, when looking back, my body was like, rest,
Screaming.
stop, you are, So, taking away that more is not better at all. Exercise is also the main way to manage EDS, but if you do too much, like anything, it's going to be worse.
Yeah. I mean, water can kill us.
I know.
But we need water to survive.
Yeah.
Exercise is still just stress.
Yeah.
And we can only cope with so much at certain times.
Yeah.
It's like I said, more is not better, more is just more.
More is, that's right.
Yeah.
More is just more to cope with.
And from the few months we've been working together, I can tell our personalities related to exercise are very similar in the fact that we always want to do more. We always want to try new exercise, new movements, new styles of training. But there's not enough time of the day, and there's not enough energy.
Exactly. Yep. Brain wants to do more than the body can.
Yep.
But yeah, so
I think that's really good. That's really succinct. That's I know I've learned a lot. Again, every one of these I learned a lot about hypermobility. That comes from your experience and your
Personal.
personal experience and your interest in the area as well.
Yeah.
Reece, do you have any questions?
No, it's very good to listen to though.
Cool.
Gained a lot of information that
We talked about this yesterday about
Yeah.
how we should, and it's answered so much already. Good. All right, quick 60 for Reece. This is something that sprung on April
Right.
right at the end, where I just asked her random questions as quickly as possible.
Okay.
And I'm sure when it's a topic that I'm doing and you're asking questions, we should flip it around.
100%.
This is where we found out April's favourite animal is the crow.
Right.
Completely threw me off.
Yeah. So just random questions.
Oh,
All related
there's a
to-
bit of a theme. There's always a slight theme to them. Alright, I'll give you a second to drink and then we'll go through. Alright. Let's go. 6 questions. Same as always. Don't think, just blurt it out. Favourite Olympic sport?
Gymnastics.
Yeah, okay. If gymnastics was off the table and you had to participate in one to get a gold medal, which one would you choose?
High jump.
Right.
Interesting.
So, I did not think that. Had to get a high medal. Had to get a gold medal as well.
Imagine me if I got a gold medal in high jump. I would wear it
aiming-
everywhere.
You're aiming so high. Literally. Least favourite sport to watch in the Olympics? Like, what do you like? Oh, bro, it's paint dry.
Is cricket in the Olympics?
That's rough. Reese's favourite sport is cricket.
Oh,
isn't it?
sorry. Everyone who loves cricket, go to Reese. Oh.
If you had a team sport that you had to watch in the Olympics that you would enjoy, so not cricket, what would you pick?
Hockey.
Ah, we do quite well at here. And finally, do you think Stephen Bradbury should have won the gold medal that year when everyone else fell over on the ice skating? You don't know who Stephen Bradbury is. He's like the old. You know who Stephen.
No, I know someone fell over.
They all. He
Yeah,
was.
and
He was coming in
oh,
last.
I've seen the video.
He was coming in
yeah,
last,
yeah.
and he had like even everyone else had the speed helmets on, and he had like a little dinky white helmet,
Yeah.
and like he was coming last. In saying that, he had to win all his heats to get there, but he was clearly outmatched. And then the last night, everyone just fell.
Yeah.
And from years on, it was called doing a Bradbury. You just came back and went everyone to screw up, and you win. How do you not know Steve? Wow.
Yeah.
I mean, sounds like a great guy.
A win's a win, right?
Wins
That's
a win.
it. Opportunistic, in the right place, the right
He
time.
was famous for a few months after that as well, and he continued like even years later. Like he was huge and he could have went one direction. This is a bit of a tangent for me. He could have went one direction, being like, "Oh, I don't deserve this. This feels wrong." If you fall over, you lose. So he had to stay standing. I don't even know if there was very much, like if the other athletes tried to contest it, like a re-race.
Yeah.
Because from memory, there's even footage where there's 3 guys like in the front jockeying for position. And just like when you see a bike crash in like the Tour de France, one of them trips over one, then the next one, and then they all just like kind of peel out to the side. And even Bradbury was like, "What the heck just happened?" I can't.
Whatever.
That's like saying, "Oh, I've never been to Bondi Beach before."
Well,
But now you can say he's got a gold medal.
He's got to go back. Famous. Alrighty, let's leave it on that note. I think next podcast we're changing topics, are we?
yes.
Yes. Okay. So, and that to be determined.
Yeah.
So,
Cliffhanger.
yes. Just like SVU. Thanks for joining us. Thanks, Maurice, for being here as well.
Thanks for
We'll
having
talk to you
me.
next time.
Yes.
Bye.